Well, I think that we're all very familiar with the opioid epidemic. It has been a theme that has resonated, in the news and in the research, in the community. Many of us personally know someone who has been affected by a substance use disorder and has seen how devastating this can be, not only to the individual, but to the family members, to the community. Acknowledging and observing that, knowing the role of dentistry in this opioid epidemic was kind of some of the factors that led to the development of this proposal.
There's over 2 million individuals that have substance use disorder, and a lot of those, that first exposure came from an opioid prescription. We know that dentists and oral surgeons in general are one of the leading prescribers of opioids to adolescents and young adults. And adolescents and young adults are at particularly high risk for developing substance use disorders or problematic opioid use after an initial exposure. What we're doing here is we're working with a lot of the largest dentist and oral surgery practices in the state to try to implement some strategies to help them revise the way that they're prescribing pain medicines to adolescents and young adult patients after they have their teeth pulled. So trying to understand how dentists make these decisions and realize that things like Tylenol and ibuprofen seem to work just as well. So how can we work with providers to understand what are the right times to use opioids, what are the right times to use non-opioid analgesics?
We have really high hopes that this intervention will reduce the number of prescriptions that dentists give to this specific population. We're also hoping that when a prescription is given, the dentist is able to evaluate many other factors, so we minimize the number of times that when we give a prescription to someone who may be at risk. But we're also hoping to implement good pain control.
We're doing some education with the dentist to teach them about other pain medicines. We're giving them some better or some patient education that describes pain control and how opioids fit into this and how non-opioids fit in. And then the final piece is we're giving them just Tylenol and ibuprofen as blister packaged medicines to say, instead of an opioid prescription, hand somebody this blister pack of medicines that we know from several studies works just as well, and you can just give it to them right here in the clinic. So the outcome that we're hoping to see from this study is likely a reduction in opioid use. I think the big piece of this is making sure that those prescriptions are intentional and kind of thought through, and that probably leads to a reduction, but really trying to empower the providers on their own to realize here's several different things that we can try and understand how they make those decisions.
Dr. Oyler and I started collaborating a few years back. And with his expertise in opioids and being at the College of Pharmacy, and my expertise in the dental field, we were able to very nicely intertwine those interests. It has been a really great collaboration. We have had the opportunity to work with many senior providers and researchers. We are in a place where the impact of interventions that are directly targeting to minimize the burden of these condition, of this disorder, can be beneficial, can be observed, and can be measured.